doctors. Thank you so much for joining for today's webinar. Our endeavor is to spread awareness about rabies, which is fatal, but we can avoid it once appropriately vaccinated. This is an innovated from Kedila through an innovation to serve the society of communicated. Doctors, the today topic of the webinar is dosage of reduction. For today's webinar, our dosage reduction strategy in rabies management, role of novel vaccine. Dear doctors, the rabies is the first novel 3-dose in anti-rabies vaccine, and with great pride, we would like to inform that the rabies has successfully completed 1 year. So much with more than 40,000 animal bite victims being vaccinated, 100% compliance was recorded, and no case of adults was registered. Today, with my honor introduced to my speaker is Dr. Raghavendra Durgoji sir, for specialty for general medicines. The doctor is service in government hospital more than 20 years. Is a friendly, humble doctor. Okay, sorry, without much of time wasting, so hand over to my speaker. Over to you, doctor.
Hello. Audible?
Yes, sir.
Introduced by Cadila company, no?
Yes, sir. Yes, sir. Yes, sir.
Introduced by Cadila company TH rabies vaccine. Dosage also is 037 doses only, and it is rabies is a deadly virus which causes usually death, and it can be preventable. The rabies is caused by the dog bite and monkey bite, dog bites also, and cat bite. Any mammals bite, usually dog bite. Rabies vaccine is preventable, and contents of this now the webinar is about rabies disease and animal bites incidence in India, epidemiology, evaluation of rabies vaccine, challenges, the unmet need, introducing TH rabies vaccine, novel technology, clinical study phase 2, clinical study phase 3, and takeaways. About rabies disease, rabies is a zoonotic disease caused by rabies virus. Virus encoded by 5 structural proteins, namely G protein, N protein, P protein, and M protein. And rabies symptoms mainly fever, headache, excessive salivation, muscle spasms, paralysis, and mental confusion. Transmitted through direct contact, broken skin or mucous membrane in eyes, nose, or mouth with saliva. It is very fatal, but it can be preventable. It moves slowly along the nerves, causing neurological symptoms leading to coma and death. Children are more likely to get rabies than adults. It mainly damages the brain and spinal cord. It causes aggression. Nerve symptoms cause aggression, seizures, and delirium. And usually prodromal symptoms like fever, sore throat, muscle pain, first initial symptoms. If get unnoticed, it causes the mainly nerve damage. It crosses the blood-brain barrier, and nerve damage. It causes seizures, hallucinations. Later, it causes seizures, hallucination, muscle twitching, tachycardia, hyperventilation, and facial paralysis. Another symptom, it can cause paralytic rabies symptoms, and usually investigations are usually saliva test and skin biopsy. And rabies is a zoonotic disease, and mainly N protein is coded by 5 proteins: N protein, G protein, M protein, and RNA, L protein, and envelope. It is covered by an envelope. Globally, epidemiology 59,000 rabies deaths per year. Among them, 20,000 deaths in India, rabies deaths per year. 91% deaths usually occurs in rural areas, mainly negligence and unnoticed. Rabies is 100% fatal, but 100% vaccine can preventable. Evolution of the rabies vaccine. Usually in 1885, live attenuated vaccine it was developed from the spinal cord, non-standardized dried preparation, up to 31 injections of increasing immunogenicity. And in 1911, inactivated vaccine brain up to 10%, Minimal neural content, liquid preparation, 14 injections each 0.5 ml daily. It was hectic. And inactivated vaccine now developed inactivated vaccine cell culture greater than 2.5 international units in 1976 developed standardized immunogenicity lyophilized 5 injections 0.5 to 1 ml 0, 3, 7, 14, 28. Now current challenges are current rabies vaccine are all cell culture vaccines. Inactive vaccines are greater than 50 years old technology, inconsistency in potency, stability, short supply, adverse events, decreased compliance beyond 3 injections. Many patients avoid fourth dose. Usually nowadays all are aware about they are taking 4 injections 0, 3, 7, 28. But now Cadila has introduced TH rabies vaccine only 3 doses is okay 0, 3 and 7 days. Meeting the unmet medical need, introducing a novel vaccine with simple and shorter regimen, introducing TH rabies. First vaccine within 3 dose intramuscular regimen 0, 3 and 7 days. It is usually prepared by VLP platform technology, first protein subunit vaccine, and better compliance due to easy to flow regimen and less visits. Mainly patients want less visits. Convenience, ready to use, no reconstitutions needed. It is readily available. No reconstitution is available. No needed. VLP technology, G protein is native virus. G protein is difficult to stabilize. Webinar is ಹೋಗಿತ್ತು ಬರ್ಕಂತೀನಿ ಬರ್ಕೊಡು ಒಂದ್ ಕಡೆ ಗಣೇಶ್ ಹತ್ರ ಬರ್ರಿ ಎಲ್ಲ ಬರ್ರಿ G protein is difficult to stabilize. G protein isolation using VLP technology purified and stabilized by Cadila Pharmaceuticals Limited. VLP are similar to native virus particles, but they do not contain the viral genome. Virus-like particles or protein complexes exist as nanoparticles. They cannot replicate but can mimic the viral antigenicity without being pathogenic. VLP is as vaccine. VLP technology and the clinical a novel recombinant rabies G protein vaccine, TH rabies, a VLP based rabies vaccine. Clinical studies noted about study design, zero protection data. About zero protection data, we have Rabipur old and days 0, 3, 7, 14 and 28, now 0, 3 and 7 days. Clinical study revealed safety and immunogenicity of novel 3-dose recombinant nanoparticle rabies G protein vaccine administered as simulated post-exposure immunization, a randomized comparator controlled multi-center phase 3 clinical study. In all these studies, to evaluate immunogenicity and safety of rabies G protein vaccine, administered as a simulated post-exposure immunization in healthy volunteers. Randomized comparative controlled multi-center study, TH rabies studies noted that to demonstrate non-inferiority of the test vaccine to the comparator vaccine, primary objective subjects with zero protection at 14 days post first dose, zero protection RVNA titer greater than 0.5 international units per ml. Secondary objective subjects with zero protection at day 42 post first dose of test vaccine, safety by monitoring subjects with adverse events. Results were noted that results were consistent across different age groups and gender. Observed difference 1.52%, 95% with the pre-specified margin of -4%. Non-inferiority of zero protection primary endpoint day 14 and 42 were met. Test and comparator are identical in zero protection rate, both on days 14 and 42. About safety also, TH rabies has better safety profile as compared to reference vaccine. In all the studies conclusion, TH rabies was non-inferior to reference vaccine, less adverse effects compared to the reference vaccine. Novel 3-dose TH rabies was found to be safe and immunogenic and was comparable to 5 doses of pre-qualified vaccine. And it has got many awards also. Pharma Innovation of the Year by the Economic Times, the Golden Globe Tigers Award Malaysia and Innovative Product of the Year. And Cadila has done a good work for introducing the TH rabies vaccine, and many lives can be saved by the TH rabies vaccine. And the dosage is also very competent, 0, 3 and 7 days, and it's also safety to use and as just adverse effects and non-inferior reference vaccine. And I thank you. I once again thank you for all of the listeners of the professionals and the medical professionals, doctors, and the Cadila company who have given me to talk about this rabies vaccine and given me one chance to talk about this rabies vaccine. Thank you very much. Thank you. Thank you all.
Thank you so much, Dr. Raghavendra sir, for the innovative talk. We would truly appreciate your efforts. Last but not the least, we would like to inform that the rabies was won to prestigious award innovative category of Economic Times of India Pharma Award and Golden Globe Tiger Award, sir. Once again, sir, any other giving the questions I will asking, sir. Sir, once again, sir. Sir, thank you, sir. Once again, sir.
Okay.
Hello. Hello. Hello, sir.
Sir. Hello, sir. Hello, sir. Sir, thank you, sir.
Hello.
Sir, thank you so much, sir. Thanks for joining, sir. Thank you so much, sir. Sir, thank you, sir. Sir, thank you so much, sir. ಅದೇ ಕ್ಲೋಸ್ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳಿದ್ರೆ ಅದಕ್ಕೆ ಒಂದ್ಸಲಿ ಕಾಲ್. Okay, sir. Thank you so much. Thanks.
Hello. Hello.
Hello.
Sir. Hello. No audible, sir.
Tell me, sir.
Sir, any high V's is a contraindication for any high V's and difficulty to
1 second,
breathe
sir.
in.
1 second, sir. Sir, 1 second, sir. Sir is just to log out. I rejoined, sir.
You know, I am speaking.
Sir.
Hello?
Okay. Vishal, sir, tell me, sir.
Hello?
Hello, Vishal, sir.
Hello?
Tell me, sir. Sir
Okay,
is
sir.
like.
Sir, it's any having Travis side effects, sir, for having. Hello?
Not any side effects. No
High
side
V's
effects.
and, sir, and difficulty to breathing and fast heart.
Nothing. Nothing. It is a symptom. If rabies comes, it can symptoms. It is. If vaccine is done, no need. No side effects. Nothing.
Oh,
TH
thank you,
rabies
sir.
is vaccine. It's safe. Very safe to use.
Oh, thank you, sir. And can I know the doses?
Sir, dose is 3037, sir. Once in a week, 1 week course, sir. This is one. Or Travis, sir.
It causes any weakness,
No,
sir?
sir.
Hello?
Hello. Sir, it is audible, sir.
Sir, Raghavendra, sir. It causes any
Hello?
weaknesses for human.
No. Nothing. It's safe to use compared to WHO vaccine. TH rabies is safe to use.
Thank you.
Okay, sir. Thank you, sir. Any no questions, sir?
Voting is sir, can you hear me? Hello, Siddhesh sir, can you hear me?
Hello. Yes, madam.
Sir, the meeting is over. We can off live stream.
Yes, madam.
We can off live stream.
Madam, it's completed, madam. Sir is outside.
Okay, thank you.
Madam, just service is log out. No?
Yes, sir.
Madam.
Yes, you are audible, sir.
Yes, madam.